Nope, it's gonna go up higher, I think, doesn't it?
Yeah, but.
At least it's there.
It's broken.
Okay, was it already broken? Maybe I didn't do it.
No, you just.
See? Alright.
Nice.
Okay, so, now that you guys had a chance to check out our super cool computer, isn't it cool to see the compressions?
Cool. That is
It is
neat.
cool, isn't it?
Yeah.
So now you understand, to get up in that green zone, it's almost like a car, right? When it's revving up, you know, you get going, you're not in those perfect RPMs until you gotta get emotion going, you gotta build up to it. That's the whole point about limiting their interruptions. Because then you know, as soon as you stop, it goes vroom, like you're at a stoplight, you know, take off again. So every time we interrupt them, we're doing this. We gotta get back up to green. So we wanna maintain green as long as we can. And that's why as soon as we shock, as soon as that shock's delivered, we're right back on the chest. Because we wanna get back up there, okay? How did it feel like it went?
Like a typical code.
Not too bad, right?
Somewhat disorganized in certain ways. And, you know, seems like you can always be doing something better.
People that were watching, / then participating, is there anything that you noticed or anything that you would add? So nobody called family. That's one thing, you know, and it's easy, right? Because we're all in a zone, we're all doing something. But that's the one thing that somebody should have delegated somebody to do, you know? We knew he was a full code already. If I didn't know, of course, we would ask that question once we got going, but we knew that from our scenario, he was a full code. But probably family, you know. If you're a family member and you're here, because you know in the first rapid response scenario, we said that we thought the wife went downstairs, right? If your husband's in 468 and there's beep 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 beep, code blue, room 468, what just happened?
She heard it.
She heard it. She heard it, right? Is she gonna come back panic?
Oh, yeah.
Most likely.
I hope pastoral care beats her there.
Yeah.
You know, but we really need to make sure that we assign somebody to the family because that's gonna be very traumatizing for them, right? And what about when he did yell at us? That's and that's what you want to have happen, right?
Whoa.
We want him to come back. That's the whole point of what we're doing is we wanna save him. What are we gonna do right away in that immediate time? What do you think? What should you expect?
Well, in that case, according to protocol, you do blood pressure,
Mhm.
you take vitals.
Stop doing CPR.
Right, we stop compressions. Now, obviously it's a scenario. He had a tube in his throat, so he probably wouldn't be able to yell at us and ask us what's going on. We wouldn't have extubated because we don't know if he's out of the woods yet.
Okay.
But we would say, all right, let's get him upstairs. You know, we wanna get him transferred, we wanna get him stabilized. That's what we would expect. Hopefully, RT is super helpful. You know, they'll probably bag him and take him up there, you know, and we'll get him on ventilator and all that type of stuff because he's had an event no matter what. We gotta make sure that we stabilize him before we, you know, go too far.
What if he starts fighting the tube?
Mama gave him some medicine.
Hmm.
I would, you know, be ready to give him a little something,
Hmm.
just until we can catch our breath,
Gotcha.
you know. Now, had he, let's say that happened, and he wasn't intubated, you know, maybe we only did not even a full cycle, not even 2 minutes of CPR, you know, got on him, did some concussions, maybe he was in a funky rhythm and he came back, and he starts yelling, and you're like, okay, good, Sam, where you been, you know? That's when I think where you're going with that is, you know, let's get that full assessment, let's figure out what's going on. He's probably still going to the unit, right? I mean, he's gonna need some critical telemetry, and we gotta try and figure out what happened, you know, what caused him to go unresponsive in the first place. We know he's sick, but, you know, what happened? So you'd still expect that, but, you know, if I had that advanced airway, don't pull it.
Okay.
Yeah. And that might be a job that you might look at Lindsay and say, you know, Lindsay, can you get me some Versed? Hopefully, my hospitalist, Dr. Dana, would have, you know, said, okay, let's get him, you know, some fentanyl and some Versed. They'll give you a dose, tell you what to give, you know, and get you there. And if they're not telling you that and the patient is getting restless, it's okay to ask. But you're gonna have ICU nurses or whoever is there helping you, you know, you're never alone.
Right.
The important thing is getting that initial stuff going.
So another thing that generally happens with every code is the nursing supervisor generally grabs the code sheet and she's keeping track of when we're giving meds, she has a
If we
list
shock
of
or
all
not
that.
shock.
So she's saying it's 2 minutes since epi was administered, or whatever the case may be. She's kind of going through that, which kind of keeps you on track, because you're very focused
Great.
on your task and not thinking about those other things. So,
And what we're doing right now actually would, you know, when everything's calm, they have a form and they'll do a debriefing. So that's a great opportunity to take a step back, because we all learn from stuff. I mean, every experience is an opportunity to learn, and they'll give you that chance, okay guys, pretend I'm your nursing supervisor, and I'll say, okay, these were the roles, do we feel like everything was covered? How did it go? Did everything work properly? Did you have what you needed? Did you have the supplies you needed? I was in a code not too long ago, where the, up in the ICU, and the nurse accidentally put sync on, and the patient was in VFib. The machine will never shock if it's in VFib, if we have sync on, because, right, we don't have an organized rhythm.
Right.
So, that was right away. She was like, I hit sync by accident. I've been doing so many cardioversions, she's like, I was in that mode, so she had pushed that, couldn't figure out it would shock, and then had to turn it back off, and then, then it would shock. But that was a great, she caught that on herself, but it was good she shared that just to remind everybody, we only need sync for cardioverting, so that was a good learning. But so they'll debrief, and usually it's either the charge nurse or nursing supervisor or somebody like that. They'll have that and have a chance for you. There's also a Code Blue committee that meets monthly, and they go over all the in-house codes and stuff. So if there's ever something that you're really needing to follow up with or something like that, that's a great opportunity to be able to ask if you can either go there or reach out to one of their committee members and be able to kind of close the. Sometimes we just, there's questions we have to answer, and that's a great resource.
If you have an opportunity, can you just sit in on those and learn?
I'm not sure what the policy is, like at the, I'm not sure who the ER representative is. I think it's, I know, is it Dr. Madden that goes to that one? And I think all the directors, so like the ICU director, the ED director, all that, I'm sure if you wanted to go and learn, if you talk to the director, because you what is it, Shannon or I'm trying to think of ED.
Oh, I don't know about ED.
Would it be Trendy? Is that who they would talk to? Okay, so you would just probably talk to Trendy and see, hey, would it be okay if I attended with you or something for learning?
Good.
I would reach out to them. Yeah? Any other thoughts? I think you guys did a great job. Like I said, the only thing I think we was missed was the family. And now that'll be in your mind, right? Because just like anything, when you do something, then that's in your mind. So I think you guys did a great job. And I'm glad you all got a chance to see the machine and what it looks like with your effective chest compressions. I think that would be a really cool thing to have in, when you do BLS and ACLS, but obviously, I don't know, that guy's like $1 million. Probably not gonna do that, but it's cool to see when you're here, right?
Yeah.
The sim lab, when you get to work in your area, like she mentioned earlier, Heather was talking, because Dana's new into the UBE role, and so she was telling her, we can set up mock codes in here. This is a training room, this is what it's here for. So if you ever do have an opportunity, or you're leading a committee, or there's something that, where you feel like you guys wanna revisit that, reach out to the UBE in your area, and they can be a great resource to be able to, do some scenarios. They can do this, Sam here, he can do strokes, codes.
Give birth.
Yeah, he can give birth.
Cry.
Oh, that, yes. His pupils change. You can feel the pulse. It's a really
I thought that
cool
was
thing.
crazy when I was listening to his heart and lungs. I
And you
was
could hear 'em?
expecting to like make something up, but no, I could.
And you can really hear 'em, right?
Yeah.
So, even that's a great learning opportunity, because what about a new grad who's never heard rails? They've never heard bronchi, they've never, they just, it never happened in their nursing career, just a really great opportunity. And they use this room for like the residents and the fellows, and it's just a really great resource that we have. So, I think you guys did awesome today. Aren't you glad you did it here? Do you feel more comfortable with the crash cart?
Oh, yeah.
Yeah, especially knowing that it just goes on in AED mode. All you gotta do is hit on and it will tell you what to do. It really takes I think some of that anxiety out of it. Because even if it's a machine you've been trained on, if you didn't use it for a year,
Yeah, right.
right? So, all right, cool. Any questions? Perfect. We're gonna get your books all signed so that we